Hello all, and welcome to another edition of What's News in Healthcare Social Media. I'm Kathy Brown of Brown Knows Social Media, and today I have a wonderfully exciting guest, Mark Seidel. Did I say your name
Seidel,
right?
yes.
Seidel. Would you like to say hello to everyone?
Hi, how you doing? I'm Mark, and thank you for having me on the show.
Mark is someone that I have just met recently that I'm looking forward to talking about his special area of focus, and we'll save that for near the end of the show because I'm hoping that that will transition into when we invite our viewers to come join us. I think it'll be a fun time to have everyone talk with them. So we're going to dive right in because those of you who have seen the event page and see all of the links that I posted, you know that I have way too many articles to talk about today, and I can't possibly get through half of them, but I wanted to share them all because they were so good. So if you have a chance after this Hangout is over, go to the very early posts and look at the links that I shared. I think that you'll find them useful. The first one that I want to talk about is Healthcare Harnesses Social Media by U.S. News. And I think this is a really interesting article because it points out the importance of listening in social media as much as posting and participating in social media. Mark, do you have any particular ways that you listen in social media to your audience?
Oh, many. Feedback, you constantly have to look at feedback. You have to know your audience. So you have to constantly pay attention to what they have to say, what they want. If you're not offering them what they're looking for, then you no longer have an audience. So I pay very close attention to what people are saying. I
do too, but this article really threw me for a loop because it wasn't really talking about your typical listening. It was talking about hospitals listening to current and local news in an effort to be more easily prepared for either a disaster or a sudden event that would need to be reacted to. And they used the example of the Chicago bombing and how the people of the local hospitals were listening and knew what was taking place before those injuries came in, and they were able to prepare for it in advance. I think that's brilliant.
Right.
So what I want to point out about this particular article is if you don't already have someone out there just listening to the local news, maybe this is an area where you want to spend a little bit of time doing something or preparing some kind of a plan to be listening out in the social space. Maybe you should have somebody assigned that task so that when something happens locally, you're ready to respond to it. Even if it isn't a local disaster, it could just be an outbreak of something. It could be the local schools are closing because of a flu epidemic. Well, if you know that that's a local topic of interest and you address it at that moment, you're going to be a lot better prepared for all the people who suddenly start calling in and asking if it's too late for a flu shot and everything else that you may otherwise have to address on a one-on-one. Another part of this article was monitoring patients. This is kind of I call it creepy. It's a little bit creepy. You know, the government listens to us. We know that now because of the Snowden issues. And this actually was, I think it was a Navy base, Navy hospital, where the employees were setting up Facebook profiles. And they were using them only for this purpose, so they weren't posting anything inappropriate on them, but they were asking their patients to friend them. And in doing so, they were able to, I don't want to say monitor because that's kind of a clinical term, but they were kind of monitoring the patients in an effort to get a better understanding of their lifestyles and the struggles that they were having. And they didn't say this directly, but they implied that a lot of it was PTSD, is that right? Post-traumatic syndrome. I don't know. Did you know?
PTSD, yeah. I get it mixed up all the time.
Yeah, and they were monitoring patients so that they would know when some of the psych patients were having harder times, struggles, and moments where maybe they needed someone to reach out privately and say, would you like to come in, or is there anything we can do, or is there somebody you'd like to talk to? I'm kind of curious what people who are watching think about that, if they think that that is crossing the line by listening and not really stalking, but listening to patients in an effort to give better. I'd like to know what you all think when you come into the discussions. Maybe we can get some live comments on that. So when we think about patients sharing in the social space some of their private thoughts that are no longer private, of course, when they go into the social space, but even if you don't actively listen to your patients for the purpose of gathering personal information about them, what happens when a patient decides to tweet you or post on your Facebook page that they're thinking about something like suicide and harming themselves? What if there is a medical emergency that you're made aware of through no fault of your own, but it happens? I am posting a question on the event page to see what some of the responses are, because is there a responsibility to respond to that? And if you knew that a patient was thinking about killing him or herself, would you respond immediately, or would you feel like you had to seek advice from someone, a superior, to know how to handle that? And should you have a plan in place ahead of time so that when something like this happens, you're equipped to address it? And we've got some answers here already that I'd like to share. Let's see what we've got here. We have Cheryl Deuce says, 15 years ago we had a tornado here in Salt Lake City. Very rare, and we're monitoring. Ever since, IHC has dedicated personnel that monitors news as well as social media for such indications. I've heard they even use it for flu outbreaks in the winter. So if they're already listening for that, Cheryl, I wonder what it would take to get them to listen to patients and just be ready for something that might be happening locally with a particular patient. I'd like you to kind of chew on that and get back with me on your answer on that. So we'll see if we get any answers regarding the tweets on patients hurting themselves. So I want to move on. We don't have a whole lot of time, so I do have to just move on. So keep your comments going, viewers, because I really like those. I was watching some of the tweet chats going on. For those of you who don't know, Simpler, sympler.com, is a great website for healthcare hashtags. And healthcare hashtags can be used for a number of things, and one of the purposes is tweet chats. There are a lot of health disease-specific tweet chats that patients participate in, usually one day a week or one day a month, and I was watching one that was specifically on HIV. And it was, let's see, what's the name of that tweet chat? Health XPH. And what I found interesting about this was it's going along the same lines of listening. I decided to go through and see what information, insights I could glean from seeing the conversations that took place in that tweet chat, because Simpler transcribes the tweet chats that have been added to their dictionary, to their directory. And in this particular tweet chat, the question was posed: what are some of the barriers, social barriers, to patients with HIV? And the common thread response that came out of that question was the lack of knowing what information that's available socially is accurate, that there's a lot of misinformation. Do you run into that yourself, Mark, that on the internet you'll find something and you question whether or not it's legitimate? It's there, but is it legitimate? Whatever the topic.
Well, it's interesting because of a 21-year survivor of HIV. I find that fascinating because you have information come out. The news media came out with antibodies to HIV have been found in saliva. The general population hears HIV in saliva and they get freaked out and they're like, oh my God, even kissing is bad, et cetera, when actually what they were saying is antibodies, which kill the virus, were found in saliva. So you can find out information like that, and it actually helps with stigmas too. So I think that's a wonderful idea and really needed.
Well, one of the comments that I read that really struck home with me is one person commented back, what we need is a reliable medical specific information of, how did they say it? I didn't put the exact quote here, but what they basically said is we need to know that the information that is out there is sponsored by a reliable hospital or medical facility. That if they knew that the location they were going to get that information, or that the source where that information came from was a reliable health resource, a health facility or hospital, they would be more likely to trust that information. And so the question that I would pose is this a growing need that we are now at a point where we need to seriously consider going in and setting up either communities or YouTube channels or whatever that collection of resource is, so that we can broadcast, hey, this is a real facility, this is a real hospital, a real health system, a real physician's office, whatever your facility is, and we're going to give you the right information. Maybe this is really calling us to task to do that.
I think it's needed, especially now that doctors have to see so many patients per hour just to make a living. It's in and out. It's needed more now than ever, as far as I can see.
Well, it's funny that you just segued perfectly into another article. One of the articles that I posted out there is the healthcare industry is pushing patients to help themselves. And this article, at first, it really didn't sit well with me. I felt like it was an article that was like a Dr. Jekyll and a Mr. Hyde, because as I started reading the article, it sounded like the author was coming from the angle of, well, doctors are too busy, they're too overworked, and they're too tired to get patients well, so they're putting the responsibility back on the patients. And I thought, wow, is that ever a poor way to approach a topic? But as I read through, it was as if the person who was writing it had stepped away and had come back, and the tone of the second part of the article was entirely different. So the article was addressing the fact that there was this new buzzword that we hear a lot called patient engagement, and that patient engagement was not just patients talking about getting better, but patients having an active role in staying healthy and what that entails. The largest barrier to patients being engaged, according to this article, was that they don't know what they can do. Even when they're told that patient medical records are going to be made available to them, a lot of them don't care because they don't know what they do with the records once they get them. Have you ever gotten medical records and you look at them and it's all Greek to you?
No, because I'm the neurotic person that would look everything up on the internet.
Okay, so you're the
But
evil.
no, I do. But I definitely understand that. You know, we're so used to doctors telling us what to do, being taken care of from cradle to grave, and we just listen to our doctors. We really do need to start taking care of ourselves and taking more control over our health care, without doubt.
And I think a lot of people want to, but if you don't know what that means, then you don't even know where to begin.
Which social media, the things that we were talking about before, could certainly help with.
That's right. And I think that this is a real opportunity for the marketing department to indirectly help with the care of patients, because if you can provide that information to patients to say, this is information we'll provide you, this is where you get it, this is how you get it, now this is how you respond to it. This is where you can get some good information, some of the other stuff you may not understand or care to look at, but here are some action steps. And if you can communicate with patients how they can take those first action steps and use the information, and maybe even supplement that with, here's a fitness app where you can track X, or for diabetes, here's a carb counter, or any of those apps that would help with being proactive about being educated and informed about lifestyle choices that will impact health. Patients will appreciate that. Physicians and other health providers will appreciate it, because these are proactive steps in keeping the patients healthy. And I think everybody wins when we communicate what can be done from the patient standpoint in combination with the health provider standpoint. One of the things I wanted to point out about this article, too, is that they talked about health-wise providing what they called information prescriptions, and they were really just videos of doctors giving specific advice about a specific disease, whether it was explaining a condition, explaining how to take a particular med or a particular procedure. My question to you as healthcare marketing professionals is, why can't you set up your own mini version of this? Maybe you don't have the budget to go on to HealthWise or to pay some other company to build and maintain this elaborate library, but YouTube is free. And as long as this information isn't specific to a patient, and as long as the information wouldn't cause someone who shouldn't have that information to get that information available, then there really isn't harm in getting these video libraries built, especially if you have them as unlisted, so that not everybody suddenly finds them. You can disseminate that through links as you see fit, if you prefer, in some of the cases where the information is more sensitive. So, have you ever gone to YouTube to find out about some kind of health information that you were looking for, Mark?
I'm sure. I think that YouTube is a valuable resource. It's, I mean, you have some pretty well-known doctors and healthcare providers on there. It's a great place to go. You know, and a lot of us, you know, you look on the internet and you look up symptoms and everything. You're like, okay, I'm dying, but there's the whole other Dr. Weil. Dr. Weil is on YouTube. And I absolutely love him. I don't know how everyone else feels about him. Yeah, I use a lot.
So obviously you found some doctors that were on YouTube as well, right? I know that. Yeah. I wish that we had more. I think that if physicians understood the value of capturing those messages that they deliver 20 times a day because 20 different patients ask the same questions, or because they have a particular process that they like to go by, which involves a little explanation over and over and over. It would be nice to have those libraries that you can refer patients to say, okay, I'm going to tell you today, but I know it might not all soak in, but here's a link to the video to refresh your memory when you need it most.
So, I mean, don't we have to call people to task here and be like, get these created? You know what I mean? This is a great opportunity for anybody to get involved in getting something like that built.
Definitely. Okay, now I want to switch topics because I'm really excited about some last-minute news that came up. One of them, well, let's lump them all together. There are several Google Plus tools that have recently been revamped that I'm really excited about, and I wish that I could say that I knew them all intimately and could run through them and give you all the highlights, but I'm still learning them. But they're well worth the visit. And the first one I want to mention is Node 3X. And Node 3X just got a major overhaul to offer some new great information about your influencers and your audience. And if you're not familiar with Node 3X, I suggest that you check it out. It provides some really great information. I'm going to put a link to on the event page that is a recent Hangout where they walked through Node 3X to highlight the changes that were going on. And now Node 3X will show you who your influencers are that are resharing your information, and it's based on keyword search on Google+. So there's a lot more graphics to understand what you're seeing. I think you do have to play around with it a little bit to really get a feel for how it's going to help you. But I remember the early days of Twitter, when we started having the third-party Twitter tools that would either help you follow or unfollow or find keywords. Were you one of the early adopters of Twitter, Mark?
I was, yeah, but in a totally different area. I was into the indie music scene, so I have a site that's dedicated to indie music, so it has nothing to do with what I'm doing now. But yes, I was, and the tools were great.
Well, when I joined Twitter, I was wing spouse, so I was doing something totally different as well. So I can relate to that. Well, another one of the tools that I'm really excited about, and I have personally been involved with, and Mark, I believe you said you were personally involved with in the early beta days, is Circlescope. And I want to clarify, I have said this tool, I've given the wrong name of this tool multiple times. I always forget there is an O between the circle and scope. It is Circlescope. And Circlescope has been around for a while, but it started out as a very hard tool to use, and you had to really want to use it to figure it out. And over the period of time, I forget how you say his name, Asten, I think is how you say his name, the creator has been reshaping it to be usable. And this is equivalent to a follow and unfollow tool in Twitter with a lot more robust opportunity. You can manage your circles. by searching within your circles and even people outside of your circles for specific conditions, whether it's their education, their employment, their job title, their geographic location, things like that that might identify people that have something in common, and you can instantly tag those that match the criteria and move them into a different circle or create a new circle. It's really powerful. One of the things I used it for recently was I went out into a community that I'm a part of but I don't own. And once I pulled up the people matching membership of that community, I looked for a particular job title so that I would know which of those community members had that particular job title. And once I identified them, I circled them into a circle of surgeons. In this case, I was looking for surgeons. And so I was able to move them into my surgeon circle because I knew that they had a particular interest based on this community that we shared. And now I also knew that they were surgeons. When you think about the possibilities there, of how people identify their lifestyle through the communities that they're a member of, and some of the other things that Circlescope identifies, this is a really exciting tool. Have you used it, Mark, to do any of your circle management?
Yeah, I sure have. I like it a lot. Well, it was very difficult to use, and then Christine DeGraff and Craig Fifield got on board and did some user interface work, and they did a fabulous job. It's much easier to use, and I would recommend it to anyone.
Yep. All right, well now we have our last topic, and as we get to our last topic, I am posting the link to join the Hangout Live, because this is the time at 11:30 that I open it up to people who are viewing to go ahead and join inside the Hangout. So as you join in the Hangout, if you would please make sure you don't have any radios or TVs going, and if you're already watching the video, please turn it off as soon as you enter the Hangout so we don't get that echo effect that we sometimes get. But I have posted that link. I'm hoping that that works. If it doesn't, then somebody can let me know through the event page. The last topic I want to get to is the one I've been waiting for. Mark, you have this wonderful, I don't even know what you call it, but it's a directory of Hangouts. You want to tell us about what you've been doing, what your effort is with Hangouts?
Okay, well, I remember in, I guess it was November, I was looking for HOAs to watch, and I couldn't find them. There was no place to find them, so I started HOAshows.com, and that was a calendar. There are several out there. Mark Bang also does a calendar. You'll see the HOA calendar, little red icon in the viewers. He also does one. And then it developed into listings, and the most recent is the archives. The archives have been quite a project. And what I had down medical, and then I talked with Kathy, and I was like, this needs to be really broken down a lot more. So I'm going to work with Kathy in getting the various aspects of healthcare broken down into categories. So, and Kathy has a page, her own page of shows that she's been on, and I'm open to any suggestions from people who are in the healthcare industry as to how to break this down and to make it, as efficient as possible for viewers.
Well, let's talk about the way I see it. And I know you probably have this vision of what you have done with it, and I'm coming in from the bystander standpoint. And what excited me about what you're doing is you're taking Hangouts that are who knows where out on Google+. I don't know half of the Hangouts that are happening. And you're tagging them, categorizing them on a page where that page represents a particular interest or category. So, for example, in the case of healthcare, you attempted to create a page that originally you called healthcare, I forget what it was, but
you made me change it.
Yeah, the title wasn't quite right, and I think now it's healthcare topics. Is that right?
It was healthcare systems.
It was healthcare systems, right?
Which was very vague.
I think they were hospitals that were doing Hangouts. Right. And so you changed it, or maybe you're in the process of changing it to healthcare topics, and then afterwards I thought, well, wait a minute, healthcare topics is so broad, and we really opened a can of worms, but the fact that you're willing to talk about this, I think, is exciting, because if we can have and you can have a tab where any physician who wants to have a healthcare hangout on air to talk about a medical condition, a disease, a procedure that is patient-directed, and there's a place where people can go for that, great. That is really a wonderful service. And at the same time, some of those might be diabetic-specific or fitness-specific, and if they can eventually have tags that kind of categorize people's hangouts by interests or lifestyles or diseases or whatever we can figure out there, that's going to be incredible. And then in my case, I don't really address the patients. I'm a service to healthcare professionals where it's healthcare social media. So when I've had my hangouts, I've been tagging them for the social media tag as well as the healthcare tag, and eventually that'll have to get resorted out to however you structure
Not
that.
eventually. I have to take care of it before it gets out of control. You ruined my life. So also, if doctors are having HOAs, just invite Mark Seidel to the event, and that automatically goes on the calendar that gets posted every day. So people can find it that way as well.
And that's an important point, because I didn't realize that when I first started. I saw your posts, and I finally caught on to the fact that I have a circle that I invite to my Hangouts, and I've added you to that circle, so you always know what my Hangouts are. We just lost Scott. We had Scott in here.
Scott's awesome.
Yeah, he is. So now that I know that that's how it works, I'm able to get on to the regular calendar, because you present a calendar that lists all these Hangouts going on, which is one-stop shopping. I think that's great. And if you could go back to the event page after we're done talking here and share a link to one of your posts that shows that calendar.
Sure.
That would be great, so people can see one of the services that you're offering in getting exposure to these Hangouts.
I certainly will. And if you have any problem with the calendar, there's a little video tutorial right before the calendar on the calendar page. Because you can also use it to go back in time in the calendar to find, HOAs that have already happened.
Oh, I did not know that.
Yeah. It's getting there.
Now, you have several categories, and I know that I was going back into Hangouts that I'd had before I had known about you, and you told me that there is a code. Am I allowed to say this?
Sure.
Okay. There's a code you gave me to categorize my Hangouts, and I'm able to go back into those YouTube Hangouts on Air and add it to the tag section of my YouTube video so that it is then categorized. And I think that's really important, because, and we don't have to give the tags out until after you get things settled. Once we get the healthcare categories settled, you know that I'm going to publish those tags as soon as you let me, so that the people who fall into that category can very quickly populate your pages. I think that will be really exciting to be able to bring to view all of the wonderful Hangouts that are happening in healthcare.
So no, we'll get those. We'll get them set up. And like I said, I'd rather get it done now before it gets out of control.
Yep. So can you tell me quickly, what was the motivation behind doing the Hangouts show website?
I couldn't find Hangouts, and I saw a need for what several people, Dennis Deuce called it the TV guide of HOAs. I just saw the need and got to work on it, and it did much better than I expected it to, and keeps me very busy. So.
I'm sure it does. Is there any kind of a membership to this?
No, not
Maybe
at all.
you should think about that.
I have Yvonne Hyman, who works on that aspect of it. Yeah, so.
Well, Scott, you were able to join us again.
It is an honor to be in a film strip with the two of you, two of my favorite people. So thank you for the invitation.
Thank
you. So
you.
were you able to hear a little bit about what Mark is doing? Are you familiar with his HOAshow.com website?
I'm familiar with it.
Yeah.
Oh.
He's very familiar with it.
And it's one of those indicators of the maturation of the industry, if you can call HOAs an industry, because without a service such as what Mark is providing, you just get lost out there. It's sort of like having a library of books without a Dewey Decimal System or even a building to put them in. So I think that especially for specialized areas, unfortunately, we still are in some silos, and if someone wants to follow healthcare or be known in healthcare, we need something such as what Mark is providing in order to just zero in on that area. But once you've found it, people will have a gold mine, and this is true for all of the subject matters that Hangouts are in, but especially important, I think, for healthcare because it's life changing. Right?
Oh, yeah.
Definitely. Well, what did you think about some of the other topics that we talked about today? Are you familiar with Node 3X and with Circlescope?
I watched the Circlescope training that was on yesterday, and it's brand new and reconstituted. I got that tool right off the bat and never used it because it was just a little bit too complex. But I was thinking that social media, marketing and PR departments in hospitals and healthcare, if they start actually getting hundreds and thousands and then maybe tens of thousands of people who are following them, who circle them and so forth, if they're really trying to make Google Plus and this platform a valuable resource, they need to get the tools of the trade. And it's a great 1-2 punch. Figure out who the influencers are, or figure out who's really active in an area, and then to be able to target communicate to them through Circlescope. So the first one, whose name I can't remember, tells you who to contact with, and then Circlescope tells you how to organize things so that you can target your interaction with them, their engagement. I think it's just brilliant. It's the professionalization of social media.
Yes, and I think if you're a local organization, let's say you're a diabetic clinic in Scranton, Pennsylvania, if you can go out to a community of that talks about either diabetic diet, specific nutrition and diet, or anything that is a community that has identified diabetes as being a central topic of that conversation, and go in there and geographically identify the members of that community, you've instantly gotten a very powerful target market in your circle to speak to.
It's as if organizations are trying to talk to their patients in persons by maybe having lunch and learns or events where people can show up. They're talking to an empty auditorium. All they have to do is turn around, face a different direction, use tools like this, and the house is packed with people who are just saying, "Hey, I'm here. Where are you?" So great that you bring these. Was that Mark?
And it's evergreen. It's out there and can be accessed at any time, which I think is phenomenal.
You make it once and you're right. It's there forever, as opposed to these poor healthcare providers. They're in the education business as well, and how many times can you say something to a newly diagnosed diabetic that is just the same old thing? After a while, the sparkle comes out of your explanation, or you've got lots of reserves. Put it on video and let especially those people who want to learn that way. Increasingly, people are relying on online resources for their information. It's their preferred way of communications. So it'll be fresh and it'll be on demand, even at 2 o'clock in the morning.
Mm-hmm. Well, I was hoping that Janine Bevin would come into the Hangout with us, because I wanted to ask her more about the post that she made on the event page about the Alzheimer's class that she said she was a part of, and I'm not sure if she's saying that it was a good source or not. I'm not exactly sure what hokum means.
Come on, Janine, come on. Why did you say Scranton, Pennsylvania? Are you from Pennsylvania?
No, it was just.
Because I am, and I was like, oh, okay.
No, actually, no. That name, because I worked for a company where their headquarters were in Scranton, Pennsylvania, and it just came to mind.
Well, come on, Janine, let's talk.
Yeah, well, she mentions that her comment was YouTube is a weird mix. If of true information in hokum. We had to watch this one on Alzheimer's in class. It was something I'll never forget. You can read and see, but to experience it for yourself will change your perception forever. And then she refers to it. It's a link that goes to that YouTube channel. And I was curious if she was suggesting that it was a good video or if it was not a good video. But there are ways to communicate information in video that you can't communicate in text, because you can create an experience through video that is not the same in words. I'm trying to think of what the one topic was. There was one where they actually changed the video. I'm trying to think of how they did it, but they made the video seem like you weren't able to quite understand. It didn't quite make sense. And then they explained later that what they were really doing was representing someone who is having trouble processing words and stimulation. So
Phenomenal.
And I can't remember if it was Alzheimer's or if it was something else, but I remember thinking that's really powerful, that you're able to give people the experience through that visual aid that they otherwise wouldn't understand.
Yeah, I
It
think
was
that's-
Alzheimer's. That might be what she's referring to too, because it was kind of a form of dementia where they expected you to know something you felt like they'd never told you.
Right.
So I wish
like that.
Janine's commenting, and she says she's at work, so she's
okay.
not able to join us. She's saying it was an example of true information found on YouTube. Thank you for clarifying that, Janine. See, even though you're not in the Hangout, you're kind of with us in spirit. So, yeah, I think that there are a lot of opportunities that we're just missing, and to be able to just create a library of resources, just a simple library of some of the safest video resources. I don't understand why more practices don't do that. And Scott, you in the video industry, have you had these discussions to find out what the hang-up is?
Well, you know, I'm stymied because I'm with you and a number of other people. It just seems so logical to be able to sit down and have a highly paid physician or surgeon or doctor, healthcare provider, talk off the top of their head for an hour, and then to turn around and take those and make them into frequently asked questions. And this is something that has not gotten, in my experience, has not gotten traction in the healthcare industry of just setting up a station where someone, when they have time, could just sit down and do something like that. Maybe have someone from the marketing or other department interview them so that you've got that interaction. So I'm not sure if I'm answering your question, but part of it is, will I emotionally connect with this doctor or with this institution? And video communicates that probably within 2 or 3 seconds, and then reinforces it for the entirety of however long that person is watching the videotape. I say videotape, it hasn't been taped in a long time. The other thing is, usually for most videos, it needs to be really short, like 1.5 minutes, 2.5, 3 minutes, because that's all the time people have nowadays. But when it comes to medical conditions, if you're interested in the topic, it doesn't matter how long as that information is valuable and it speaks to your condition or your loved one's condition, it can be almost any length at all. 45 minutes if I feel that I need to know that medical information for me, then that's the right amount of time. So you don't even have to worry about keeping it short. Just have to worry about keeping it content dense so that people can watch and understand and appreciate what you're doing. And the key to that is that they'll appreciate it, and when they talk to their friends and neighbors, guess what they're going to do? They're going to say, hey, I happen to see, and then that's your word of mouth marketing.
Well, and I think in the case of Hangouts, Hangouts on Air, for medical professionals to have Hangouts on Air is really just the next level of video, because with it being live, this is a good example. Janine is not with us inside the Hangout, but Janine just had a conversation with us. Now, as a medical professional, if I'm talking about a topic and my compliance team or my legal team is telling me to be careful not to address specific patients' information. This is a nice, safe way to see what the audience is saying, because I'm able to monitor what comments are going on out there in the Google Plus sphere and YouTube, and to be able to bring in those comments in whatever generic term you need, and to redirect your conversation so that you get live feedback of how well you're delivering the message and where the misinformation or the questions are. So it's a great way to communicate with patients and build that interaction, that live interaction, in a very safe way.
Yeah, I just wanted to mention that Janine just said that we need a med tube that differentiates videos with actual authority and information versus random user uploading whatever advice they feel like filming. And once again, that's a, called a task. I mean, this needs to be done.
Mark's going to get right on that, Janine.
Oh no, Mark's not. Mark will help somebody get that started. That would be absolutely wonderful. But somebody out there, if they have have the time to do it.
What a magnanimous and generous offer, and anyone out there, it's the early bird who gets the worm. And if you're a healthcare provider or hospital and really want to make an impact, if you can connect with Mark, you'll be at the tip of the sword. And a year or two from now, when others are beginning to wake up, they won't know what hit them, because you'll be so far down the road in terms of social media and Google Plus and Hangouts. They just won't understand how you could have done it. But those of us probably watching now and in the film strip know exactly how that happens.
Well, and a good example of that is Larry Fournier. Larry Fournier was one of the very early Hangout artists, I call him, for the cooking show, and he started a cooking channel, which is the same concept. And now he has all kinds of variations of cooking topics within this very large cooking channel, that if you want to know all things cooking on Hangouts, and it wouldn't just have to be Hangouts, but that's a very good early example. And Mayo Clinic really has the foundation to do something like this if they wanted to expand into the Hangouts on Air and beyond their own library resources. If they were to vet the information and it appeared in the Mayo Clinic library of resources, people automatically know that that's a very reliable resource location to get information. And I think that if they're listening, that this would be a great thing to kind of think about and decide if you might want to do some kind of a marrying of this information, because there are physicians out there. And I could start naming them right now, the ones that are doing Hangouts and video recordings that are very useful. And Howard Lux is just one that comes to mind immediately. And Jay Harness with Breast Cancer Answers. And I could go on just naming these doctors that are doing really good things. Well, we are at the...
I'm going to interrupt you, because Larry has 1,155,000 followers. And so what happens is that anyone hopping on early, sorry for interrupting you, but I mean, maybe that will motivate someone. And this is just an individual. This isn't someone who started off on a high plane. Each one of those came from zero. So sorry, I'll let you get back on track. But anyone who wants to...
Right, if you don't do it, someone else will.
Absolutely. Well, and just to show you the value of video, and especially Hangouts, which is something that is not really being incorporated right now in a lot of people's library of resources. Last week, or I guess now 2 weeks ago, I mentioned a tool called Plus My Reach, where you can track the reach of your events when you post them. And I ran a report yesterday so that I could look at my reach prior to this event happening. And this week, my reach was over 4 million people because of the number of reshares to my event page. That's amazing. Now, I don't have 4 million viewers, but I had 4 million people that were able to see what I was offering and choose to watch it or to watch it later. And I do continue to have those views after my Hangouts are over.
Yeah, that's your footprint.
Yep. So we are going to have to wrap it up for now because it is a quarter till. And we have talked about some of the topics I posted on the event page, so go and look at the rest of the topics. And if you are so inclined to answer some of the questions that I posted on the event page, I've decided now that I like to continue the conversation. I have so much fun continuing this conversation on the event page when the events are over. So post your thoughts, and we'll continue this conversation, and sometimes it might even spawn next week's conversation. So I want to thank Mark and Scott for joining me today, and Mark for you being my guest co-host for this week's What's News in Healthcare Social Media.
Thank you for having me on, and for the surprise.
And this concludes this week's edition of What's News in Healthcare Social Media. Goodbye.